Mr. Chairman, thank you very much for that accommodation. I really appreciate it. And thank you to all of our witnesses who've come today to talk about the 340B program, which has helped a lot of our hospitals and health centers stretch their resources and serve their communities. Today's hearing is very important and long overdue. For over a quarter of a century, the 340B program has been a critical safety net for health providers that bear the burden of caring for some of our patients and communities with the greatest needs and fewest resources. The 340B program was started in 1992 with a simple goal: to stretch scarce federal resources to provide more comprehensive services to vulnerable populations. The way it works is equally simple. It requires pharmaceutical companies to make drugs more affordable for certain health providers serving vulnerable population and low-income patients. And those savings can help those providers stretch their resources even further. Like at St. Mary Medical Center in Walla Walla, Washington. In 2016, 2 out of every 5 patients they saw were on Medicare. Another 1 in 5 was either on Medicaid or uninsured. 340B savings helped that hospital support basic school-based health clinics for at-risk elementary and high school students, run a drive-through flu clinic to provide free vaccines to hundreds of low-income families, and provide low-cost or free medications. At Sacred Heart Medical Center and Children's Hospital in Spokane, a third of their 2016 patients were on Medicare, another third on Medicaid or uninsured. When one of their elderly patients didn't know how he could afford a $400 medicine, 340B savings helped the hospital charge only $80, a fifth of the cost. That's a price he could manage. And he's not the only one. Sacred Heart gives away as much as $55 million a year in free and discounted care. You can also see 340B at work at the University of Washington, which has used 340B savings to stretch its reach with innovative initiatives like the university's Telepain program, which is combating the opioid epidemic through innovative audio and video conferencing support for providers treating rural patients who struggle to manage chronic pain. This program doesn't just work in Washington. Participants cover Wyoming, Montana, Oregon, Idaho, and beyond. The university also runs the Third Avenue Center, which provides physical and mental health care to women who experience homelessness. The center is co-located at YWCA's Angeline's Women's Shelter so that vulnerable women can access coordinated care in a safe environment. These great programs are made possible by 340B savings, and they're just a few examples of how the 340B program can be a great resource for doing good. Of course, for us to ensure this program does good, we have to ask whether it is implemented well, and we have to ask whether we can make it better. Accountability and transparency are important to address concerns about whether entities are using the 340B savings appropriately and whether pharmaceutical manufacturers are providing discounts fairly. We can and should provide accountability in a way that strengthens and preserves this program. Unfortunately, despite President Trump's repeated promises to tackle drug prices, when it comes to the 340B program, which actually helps reduce drug costs, his record shows only broken promises and backward steps, like when he sabotaged an attempt to make sure drug companies play by the rules. When Congress passed the Affordable Care Act, we gave the Health Resources and Services Administration, HRSA, new tools to keep the 340B program accountable. HRSA has taken steps to provide greater education and conduct more audits to prevent hospitals and providers from taking advantage of the system. And after the HHS Inspector General found many drug companies were overcharging, HRSA finally drafted a rule to make sure drug companies were actually giving the full discounts required. However, President Trump continues to delay that rule designed to hold drug companies accountable for overcharging. And President Trump took another enormous step backward when his administration implemented a significant cut to the 340B program. The Centers for Medicare and Medicaid Services has traditionally reimbursed 340B eligible hospitals for drugs at the same rate as all other hospitals. However, this year they are making unnecessary cuts and paying less than 80% of market price, reducing the ability of 340B providers to offer the outstanding services patients and families count on. Skyrocketing drug prices are a dire problem, and they deserve our urgent attention and serious solutions. Needless to say, rolling back rules to prevent overcharging from drug companies and cutting back programs that help make drugs more affordable is not going to get the job done. cost of 340B discounts to the pharmaceutical industry is about 1% of the total U.S. drug market. That is by no measure a big dent. It's a single penny out of every dollar. But that small penny, that small percent can make a big difference. It can make a difference to the low-income patients and communities who could not otherwise afford the treatment they need, and it can make a difference to the hospitals and health centers who couldn't otherwise stretch their resources far enough to care for those communities. So I really appreciate all of our witnesses who are here today to talk about how we can make sure this 340B program is accountable enough to fulfill its intent and strong enough to continue serving our communities for generations to come. So thank you very much, Mr. Chairman, for accommodating me. My staff is here. I will submit my questions for the record. We have other senators are here as well. And again, we appreciate all of your contributions.
Thank you, Senator Murray.